Thanks again, Renee, for doing the interview. Appreciate it.
Thank you, Nestor.
So, of course, as I know, you're an audiologist and you deal with the hearing impaired and the deaf. And the new normal going forward is going to be the use of mask over the face. And can you explain how that presents a very big problem for your clients?
Sure. So I'm Renee Koffend. I'm with Guam Hearing Doctors. And so I see patients from pediatric patients all the way to adult patients. And I've had many of my patients come in saying that they're really struggling with communication, because when you have a mask on, not only does it muffle a person's speech, but it also takes away from their ability to use visual, facial expressions, and do any type of lip reading, which is important when you have hearing loss, because communication is not just hearing. Understanding conversation is not just an auditory thing, it's also very visual. My patients need to look at facial expressions and gestures to fill in the things that they're missing auditorily. Also, with masks, it's hard to wear a mask all day long. And so if you have a hearing aid back here, there's a lot of added bulk. So they're a higher risk for losing their instruments. I've already had a pediatric patient lose her hearing aid because it's taking it off when you're in the car, putting it back on before you go into a store, then, all those things. So it's a lot of bulk behind the ears. My older patients, if they're wearing glasses and then using the mask, there's a lot of stuff going on here. So not only is speech more muffled with the mask, not only are they not able to use facial expressions and lip reading, but there's a lot of stuff going on behind their ears and they're struggling with that.
Yeah, as you've just explained, that presents a great deal of difficulties for them. How can they overcome that? What are your suggestions for that?
So my patients have come on in, and on hearing aids, there's buttons. And most instruments, when I set them, they're pretty automatic. It's just set it and forget it. But now I've had that button become active that can allow them to have a louder setting. Because with everybody's speech more muffled and with social distancing, you're going to always do better hearing somebody at an arm's length apart. Well, now we're 6 feet apart. So not only is their face covered, but your primary speaker is at a greater distance. So now they can press the button on their hearing aid, and that hearing aid would be a louder setting that which would allow them to hear a conversation better.
Yeah. Is there anything that we normal hearing, for lack of a better word, normal hearing people can do to assist your patients? Other than all of us learn ASL.
Yeah, and so even without the mask, I'll have to train family members or counsel family members not to just make speech louder, but to control the rate of speech. And instead of saying, what do you want on your pizza? What do you want on your pizza? And repeating the same thing, you can always say, well, I'm going to have pepperoni and cheese on my pizza. What would you like on your pizza? So rephrasing the question and slowing down the rate of your speech does help a person with hearing loss, with or without a mask. That would always help them.
Yeah, I think that's one of the things that I'm glad to bring you on, because I think that's one of the things probably of many that we just simply overlook in this so-called new normal that we're facing in the days ahead.
Another interesting thing, Nestor, is with home quarantine, you've got everybody at home now. So homes are noisier than normal. And so I did say that I could adjust the hearing instrument to have a button to make things louder. I've actually had patients saying, well, now everybody's at home and I'm used to more quiet. Can you put a mute button, a mute setting? So I've had that challenge. I've also had some patients who wanted to postpone buying hearing aids. And now that families are together, that person with the hearing loss, it's their communication struggles it's more noticeable. So I've had spouses and children say, we're coming down to make a deposit because, this is frustrating for us that we're repeating, the TV's up too loud. So people are at home communicating, more opportunities to communicate and interact with families, and they don't want that person with hearing loss to feel isolated and withdrawn. So they're recognizing the more immediate need to do something about it.
All right, thank you. Anything else you'd like to add?
If you're worried about your hearing or suspect you have a hearing loss, we're Guam Hearing Doctors, and we'd like to help you.